Hello, my name's Maria Principe. I'm Assistant Director of Market Management, Procurement and Redesign at NHS Nottingham City, and practice-based commissioning comes within my remit. Practice-based commissioning began in 2005 and has since become a cornerstone of health policy reform. It's about engaging practices and other primary care professionals in the commissioning of services. After all, who is better placed to advise on the needs of their patient population than the primary care clinicians at the forefront of service delivery? This film will look at what has been viewed as the benefits and the challenges of PBC, and to take a look at what has been achieved in Nottingham City, and to ask what is the vision for the future of PBC. So first of all, let's take a look at what are considered to be the benefits of PBC in NHS Nottingham City.
The first thing is to say I think practice-based commissioning is a policy that's here to stay. I think it's about effective clinical engagement, and I think the direction of travel is that we get general practice in its totality far more engaged in making decisions about the £500 million a year we spend on health and healthcare in Nottingham City.
I've been involved with the PCT and PCGs from a very long time, actually, from the inception of these organisations. The benefit what I see is that getting the care closer to home, especially with our people, like I mentioned to you, the dietitian there, the mental health worker there, the physiotherapy services which are being developed, the dietetic services which are being developed as well there, the diagnostic, the MRI scans coming up into being done at a faster rate than it was done before.
I think practice-based commissioning can deliver lots of benefits to patients, and I think one of the things about that would be delivering local services targeted to the local population. I think there's also a prime opportunity to look at promoting specific health promotion messages and really grasping the public health agenda, because if we combine those key health promotion messages along with targeted clinical services, then I think that will help to reduce health inequalities in Nottingham City.
Well, the University of Nottingham has always been an important part of the City of Nottingham, but the numbers entering higher education have increased substantially over the last decade, and now the student population makes up at least 10% of the City of Nottingham. This is a young, it's a vibrant and increasingly internationalised population of very different health needs from that of the rest of the population, and we saw PBC as a way of addressing those health needs and making sure the PCT understood them.
We're doing quite a lot of things at Robin Hood Cluster. The first thing we did about 2 years ago was that we had a 5-year vision of where we want to go as a cluster, and we've been working on that slowly. We're getting all practices to contribute to the annual business plan, and we're getting patients involved with that as well. And you know, just good communication, not only in the practice but amongst the practice in the cluster and with other organisations.
My own belief is that practice-based commissioning is a very important part of health care for the next few years, so I was personally committed to it, so I thought that there was an opportunity at Norcom, so I thought I'd take it and try and move it forward. I did this after consultation with a few of the local GPs who thought that I might be able to do it, so I thought that it was okay.
The experience that Nottingham University Hospitals has had with practice-based commissions is really positive. Personally, I've had the privilege and pleasure of working with a number of practice-based leads. We have regular, albeit infrequent, discussions involving senior staff from within the Trust with the PBC board. And of course, the most important thing relates to deeds, not words. And what's really encouraging is a range of service improvements that either are in place or are in the process of being put into place that materially improve the experience of the patients that we all have a concern to do the best job for.
Practice-based commissioning offers a number of benefits to everybody in the healthcare sector, from the PCT to the patient and the GPs as well. Hopefully, by working together, we can improve patient care, we can provide care closer to home, and we can provide the care that patients need.
I think the prime benefit is that it enables a really powerful conversation to take place with primary care colleagues and hospital-based colleagues and patients. so that we can better understand how we within the hospital service can better support those in primary care and patients.
The ultimate game should be to reduce health inequalities, improve patient care, bring care closer to home and increase productivity. And that needs to be commission care across integrated pathways, including secondary care and community services as well.
I work for the Zone Youth Project, which was the project commissioned by the City Central Cluster to deliver the youth health project on their behalf. I feel that the PBC could deliver a lot of services for young people. We've certainly found through the questionnaires we've done with young people that there's a lot of gaps in the service and a lot of different projects that could be run, such as youth health clinics specifically for young people in the centre of town.
The key benefit of PBC is that it's GP-led. It's GPs identifying what the needs are of their patients and working towards delivering activities to respond to them.
Well, it's an ideal opportunity for practices and clinicians to have their say on how services can be improved for their patient population.
The benefits to the patients was the fact that they had more intensive service available, dietetic service available to them, with regards to the fact that they had accessibility at their own GP practice or a local GP practice, and it also enabled them to get further follow-up as required.
I think you only have to look at some of the practical things we have on the ground in Nottingham City to realise the real strength of practice-based commissioning. Direct access physiotherapy, the real role general practitioners have played in reducing waiting times. Almost 70% of patients in Nottingham now are seen within 13 weeks. Some really innovative plans about addressing sexual health, and also strengthening teams around community diabetes. And these are only a small number of really powerful schemes.